This is Jacqueline Harris, physician owner of Desert Direct Primary Care. My family has health insurance through the small business that my husband owns. He pays a small fortune for this insurance, though, so we are always eager to learn better ways to give his employees and their families access to great medical care.
Hi, this is Dr. Joanne Beltry from WonderCare Pediatrics. I just opened last month and I'm busy trying to recruit patients. But I'm very fortunate that my husband works for our state university, and so we have very good health insurance through him. Before I left my urgent care practice, I was able to transfer over other benefits like my 401k and life insurance into a private benefit fund. So I was able to make a clean break with my salaried practice and have my benefits in other ways.
So what do you do for your family's health coverage? If you've ever wondered how other DPC doctors handle insurance or health shares, check out the latest issue of the toolkit from My DPC Story at mydpcstory.com/magazine. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story Podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Maryal Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Why are you doing this? And what do you want to get out of it? And for me, it was just taking a step back and realizing this is not what I want to be doing. And I'm not happy and I'm not satisfied doing this. And remembering how valuable you're worth and making sure that you feel really good about what you're doing, because leaving is hard and totally starting on a new path is really hard, but it's so incredibly rewarding when you finally get to be working towards something that you absolutely love doing and that you are so passionate about. I'm Dr. Sassy Weinstein of Core Sports Medicine and Lifestyle Medicine, and this is my direct specialty care story.
Dr. Sarah Sassy Weinstein, triple board certified in family medicine, sports medicine, and lifestyle medicine, finished her family medicine residency and then headed to Colorado for a sports medicine fellowship. She then expanded her expertise by becoming board certified in lifestyle medicine. Now practicing in Princeton, New Jersey, she blends advanced sports medicine techniques with holistic lifestyle-focused care, all within a direct specialty care model that cuts out needless insurance barriers. Welcome to the podcast, Dr. Weinstein.
Thank you so much for having me. Really excited to be here with you.
I think this is such a treat because you started out as family medicine. However, you then went on to be triple board certified. So I love that we're going to be delving into your journey in family medicine, sports medicine, and lifestyle medicine in a time where we see people asking for a combination of those things, even in a family practice clinic. So I absolutely love that you're joining us today.
Yes, super excited. I think it's one of the greatest combos out there. Obviously, I'm very biased, but I think the combination of kind of what I do is super exciting, and I love doing it. It's what I'm most passionate about, and I just love talking to people about it.
I love it. So I have definitely been trolling in a good way the podcast feeds, and when it comes to hearing your story, and definitely this is my DPC story. I love to hear the backstory, but I mentioned to you before we started recording, I would hear things that other interviewers would ask of you, and then I'm like, but I want to know more about that. And one of the big things that I really picked up on is that you said in one of your podcast interviews, you don't know what you don't know. And that is so pertinent to our medical and personal journeys in life. And you also mentioned that you had a family doctor who was an impressionable mentor in your life. What was it that you picked up on from seeing your family doctor, but also deciding to go into medicine?
Yeah, I mean, I think you don't know, you don't know. I feel like I am learning that literally every single day. And I think when you start your own practice and you're going into something that is such an unknown and something that we are not taught in medical school. Is just figuring it out and just trying to do your best and just talking to as many people as possible and learning as much as you can. And it's when you first start out in medical school, the curve is like just learning so much at such a quick speed. But yeah, I definitely had a family doc growing up. He also was the one that told me not to go into medicine. I don't know. He was an incredible family physician. And obviously he was an older family physician that practiced in a time where medicine was different. And they really was an incredible specialty. I still think it's such an incredible specialty and I would do nothing else besides be a physician. I feel so lucky to do that. But he was an incredible diagnostician. He really took the time with people. He got to know them. He knew his patients well. He knew their stories. I mean, we were good family friends with them, but I just feel like how he approached patients was special. And he also diagnosed when I had Lyme disease. When I was in high school, obviously I grew up in New Jersey, so in a place with a lot of ticks, and I grew up on a farm, and I also played sports year round. And I started just having all of this different joint pain. It was my ankles, it was my knees, it was my elbows, it was my back. And I remember I was in high school and I kept going back to my physiatrist at the time. And he was like, it's tendonitis here, it's tendonitis there, right? You play sports year round. And I started my basketball season that year wearing a brace on my ankle, my knee, my elbow, my back. And I got to a point where it just hurt to walk. And I'm like, I don't feel like this is normal for somebody in high school. And I was definitely not reading so far into it, but it just hurt every day. And then went to my family doc and tested, and he was like, you have Lyme. And it just had progressed to the joint pain part. And so I remember that so specifically, that it was just listening to kind of the story and also just knowing some of the background and who I was, right? And so I thought that was, that taught me a lot, that you have to go kind of beneath the surface. And so when I look at patients in sports medicine, and this is where the lifestyle medicine really comes in, when someone comes in with knee pain, right, it's not just the knee that we're looking at. It's the joint above, it's the joint below, but it's also what's going on in their life, right? So is there a lot of stress that's going on right now? Are they eating a super ultra processed diet that is really high and, has a lot of high inflammatory foods that's now affecting their joints? Are they not sleeping at night because, they have a new baby, and so the lack of sleep is just causing more inflammation? So there's so many other factors that go into what people are presenting with. And I think you have to really sit down and talk to someone and listen to them and get to know them and treat them as more than just a joint or just a tendon issue, right? And I think that's one of the issues of working in a bigger practice, kind of where I started off, is you have 10 minutes per patient, right? And so by the time that they actually get roomed and the medical assistant does everything they need to, it's really like you have 5 minutes before you're supposed to be with your next patient, and you can't talk about any of that stuff. You really are just like, okay, what's going on with your knee? How can I make you feel better? So it taught me a lot about kind of how to approach patient care and what's really important to a patient who's going through all of this stuff.
I know for a lot of listeners out there, they listen on the East Coast at around 5 o'clock in the morning. We see the spike in the data as soon as the podcast drops at 2 a.m. Pacific. But I'm like, just hearing this so far at this part of your interview, you've talked about your history as a patient. You've talked about the pain that we all know is in fee-for-service with that quick turnaround. I want to just take a little side step back, though. When you mentioned that your family doctor said that you should not go into medicine, tell us more about that, because I have so many things to say about when people tell us what we should and should not do, but I would love to hear what was it and what was your reaction, because I see that as we don't know what we don't know, you have the physician entrepreneurial spirit, and you continued on to the point where we're talking about your specialty care story today.
Stay with us. We'll be right back.
Coming up November 25th at 12 p.m. Pacific, join My DPC Story and the DPC Coalition for a live Q&A on the Big Beautiful Bill, Direct Primary Care, and HSAs. We'll break down what this landmark legislation and H.R. 1 mean for the future of DPC, and you'll have a chance to ask your questions directly to those helping drive change in Washington, D.C. So don't miss out. Register today at dpcare.org. That's dpcare.org.
Yeah. So I think when I heard that, I mean, I was still fairly young, right? I think I was either in high school or maybe early college. And I didn't decide I wanted to go to medical school until I was a junior in college. And honestly, I wasn't the one that really thought about it. I went into college and I was like, I love everything fitness, nutrition, working out. Maybe I'll be an athletic trainer. Maybe I'll be a personal trainer. Maybe I'll be a physician assistant. Maybe I'll be a physical therapist, right? And so I majored in exercise physiology and exercise science. And so I was exposed to all of those different things. And in that major with people who were going into all of those programs. And I finally just had this conversation with my advisor junior year. And he was like, you should just apply to medical school. And I was like, okay. And I honestly didn't think about it twice after that. And he was like, you have the mindset, you have the discipline, you have the work ethic and everything. Just, you should apply to medical school. And from that point forward, I was like, okay, so what do I have to do? I have to take all these prerequisites, make sure I'm hitting all that. But yeah, so I think whether it was high school or college, when my family physician said that, I thought about it for a second, but also I could tell he was at this point in his career where there was such a change in medicine. And at that time, I had no idea what that looked like from his standpoint, right? I could tell that he probably was not as happy in medicine as he used to be. He had his own practice, but things were changing from a reimbursement standpoint. Things were changing from what was demanded and required of him, how much he had to work, how much he was responsible for, the billing, all of that stuff. But I had no idea of that when he mentioned that. I think it wasn't until later where I sort of understood. And from my standpoint, all I knew was that he was not as happy in medicine as he used to be, and he wasn't treated the way that he used to be as a physician. And it honestly it stuck out of my mind because of what he said, but I could tell that there was like a shift in his practice, but it never deterred me. I knew that's kind of what I was going to do. And I just felt like I kind of set along this path and I was like, I'll figure it out. And again, I was probably very naive back then and didn't know the nuances of what was actually affecting him. But I was like, I'll figure it out. Let's just see how it goes.
Amen. And I am, and your patients are so glad. And I know you are glad that you were just like, cool, I'm moving on with my life. And right. I will say for the listeners out there, what Dr. Weinstein experienced, a lot of us have had people tell us like, oh, you shouldn't do, you can't do. And one, Beyonce, Who Run the World Girls, is singing in my head right now, but also the fact that it's probably their problem and not your problem that they're actually commenting about. So you eventually went to do training in Colorado. And not only did you do training in Colorado where sports are very treasured, but also you went on to be part of the team taking care of Division I athletes, the Denver Nuggets. And I think about your journey into medicine with this description that you just gave of like, you had a knee brace, a back brace, and all of these things. And I just think about what was it that you were bringing as uniquely you to the table when you were with these athletes, because you are an athlete. You continue to teach private classes in Princeton, which is amazing because only in direct specialty care could you do that as well as be a doctor.
That's right.
But
that's right.
Also you just are going through your entire career. Maybe you don't know what you don't know, but you sure as heck know what it is like to be a patient and to not want to be in a certain way when you're showing up on the court.
100%. And I mean, the Lyme story, that was just one, right? And so I feel like my high school career I was sidelined a lot. The first big injury I had was a traumatic brain injury from playing basketball. And that kept me out for a really long time. And I would say changed me forever. And so I learned a lot about head injuries, and I learned so much more now, kind of looking back on everything that I went through when I was a patient for an incredibly long time and still am. Like I still feel like I am dealing with some of that. And so being able to be on this side, and that's why I chose sports medicine, is because whether it was the head injury from sports, whether it was the Lyme, whether it was, I had mono, I had tons of other things that happened, but it just showed me that being a patient, like, it sucks being sidelined. And like, that is so much of who you are as a person, being a teammate, being on the field. And so like, even in high school, I just had to learn to adapt and like be okay being on the sideline when I was hurt or sick or injured and medically sidelined. And I learned a lot about like camaraderie and being a really good teammate and making sure that I was still there for people. But it hurts. Like, it hurts mentally, it hurts physically. And so when I went into fellowship, you know how much of an emotional and mental and physical toll it takes on these athletes when they can't do, especially at a D1 level, when you can't do that, like, that's so much of your identity. And so being able to realize that and like being there for them in a different way and not just talking about their injury, but realizing there's so much more of their life that's affected when they can't play, and really making sure that they can get through it and come out the other side and persevere and know it's going to be okay is, I think it was a really, I mean, it sucked going through it, obviously, but it's a really important part and really showed me how to be so much more compassionate and be a better physician.
Yeah. And it really is a testament to, now fast forwarding, your patients want you as a physician because you're bringing all of you to the table, including your history as a person who has dealt with doing sports while taking care of other people to prevent their injuries or helping prevent their injuries and taking care of your own injuries. I just think about even your website, like you have concussion is one of the things that you treat on the bottom of that, the above the fold. And it's, I love these little details on people's websites and just their practice, because we put our personality and our history into our practices. So you then got lifestyle medicine certified. Tell us about that journey, because definitely lifestyle medicine, I was talking with somebody about, what do people want, lifestyle medicine or family practice? And I'm like, in direct primary care, whether we are primary care focused or doing direct primary care as a business model, like in your case, lifestyle medicine is very easy to incorporate because we have time with our patients and we have time overtime with our patients. And so for you, what was it that drove you to add lifestyle medicine certification, especially to your sports medicine, family medicine certifications?
Yeah, it was actually when I was on my first maternity leave, when you just have some extra time, especially with your first baby. And I was like, all right, great. What's this next step? And I grew up, and my mom was a naturopath, and I just grew up kind of being exposed to all of this different stuff. I grew up on a farm, so we had lots of fresh fruits and veggies and exposure to natural air, and was just outside all the time. And so it was something I was always so passionate about. I actually did a month-long rotation in integrative medicine when I was in medical school in my 4th year at the Andrew Weil Institute in Arizona. And that was an incredible experience. And so I was like, I knew I wanted to do something else because it was stuff that I talked about to patients all the time anyway. So I was like, do I decide, integrative medicine? Do I do functional medicine? And so I was like looking at all these different things, and I had not even heard of lifestyle medicine at the time, but until my research, I came across it and I was like, this is exactly what I want to do. It's evidence-based. It's everything I talk about anyways, and it makes perfect sense. So ever since kind of finding out about it, I was like, all right, well, let's just start looking at the certification. What does that look like? And I started it while I was on maternity leave and just kind of continued on it while I was at my first practice and got the board certification. And again, it almost felt like I wasn't being forced to do anything because I was just learning stuff, and now just like learning the studies and the research and the evidence behind all of these things that I talk about to just feel even more confident talking about it to patients. Not that I had the time at my first practice, but that's why I do what I do now.
With that lifestyle medicine and your other 2 board certifications, you were in a practice for 3 years, really going hardcore in providing amazing orthopedic care to people. So talk to us about how, as a family physician and lifestyle medicine physician and sports medicine fellowship trained, you just went wild in the orthopedic world, because I love when we get to do what we want to do in direct specialty care, direct primary care, because like I think about the people who are family medicine physicians and they still want to do deliveries after. And they're like, oh, I can't do that in direct primary care. I'm like, yeah, you could. We did a whole conference with FlexMed staff on how you could do locums and how you could do direct contracting. So don't say no until you actually try, right? So how did you, though, go crazy like a kid in the candy store when you were surrounded by people doing ortho all the time?
Yeah. I mean, I love the ortho world. When I was in residency and even towards the end of medical school, like sports medicine is what I wanted to do. And I got towards the end of family medicine residency, and I probably, like a lot of other family physicians going through residency, I felt somewhat burnt out, even just from straight primary care. And I really did not like being in the hospital, and I still don't. And I was like, at that point, my vision was I was going to fellowship, and I was like, yes, I get to finally be doing like what I absolutely love doing. And I get to do that all the time, aside from a little bit of family medicine that I did during fellowship. But so it felt like a natural next step for me. And I knew I kind of not grew up, but in medical school, my mentors were from where I started my first job. And so I kind of started talking to them towards the end of fellowship, and which happened to be right as COVID started. And so I took a job with them, and then they went on a hiring freeze. I ended up starting just a few months after that. But to me, I was like, okay, great. And I knew in my head that working there was not going to be my last job. But I also knew I'm a new graduate, I'm a new attending, and this is a great place to start because I'll be surrounded by incredibly smart colleagues, and I can curbside people, which is exactly what I did. And I was just surrounded by people who were so helpful, like all of these ortho surgeons, all of these PM&R docs, so helpful. I mean, I would go up to them in the beginning and be like, does this x-ray look fine? And you're a new attending, so you want to make sure you're nervous. And I think being in that community and having that support was so helpful. And so I really enjoyed it there, aside from not having the time to really talk to patients about what I wanted. But it was such a great way to start seeing like a higher volume of patients, just get more comfortable being in a practice and being out on my own and having the resources there to help me. So it just seemed like a really logical next step for me.
I love that. And especially when we talk about resources, like I'm of the generation where we didn't have POCUS during training. And so I've had to take classes after to incorporate POCUS in, but it's, again, just referring to your website, like you're there with your ultrasound machine on the lady's knee. And it's fantastic that you had this. It's just a part of how you practice. You have all of these tools that you're able to pull from, knowledge you're able to pull from, experience you're able to pull from. When it comes to job offerings, had you looked at a bigger corporate group compared to the one that you eventually stayed on with for the first 3 years as an attending? Because I think about those golden handcuffs are really pretty, lots of money, lots of benefits, 401k match, all the things. But it's like you didn't necessarily go to a big corporate model where you had to work in hospital.
The group I worked with was a big corporate model. In the ortho world, it's probably one of the biggest groups out there. And so they started in PA, really in Philly was kind of their main hub site, and then expanded into New Jersey, have expanded a little bit into Florida. So the group that I joined actually was a small group that actually got acquired by the larger group. And so it was actually kind of nice because where I am in New Jersey, it almost felt like I wasn't working for like the large business, and I almost felt like I was able to still do kind of what I wanted to do because I was in this smaller cohort, and that was actually really nice, rather than I think my experience would have been really different had I been working at one of their main sites that's insanely busy and just seeing so many people. There's so many docs there, but I think there's 200 plus, probably more at this point, docs in the group kind of across the 3 states, and obviously tons of physician assistants and everybody else. So that's kind of why I knew that long term, this was probably not going to be where I end up, because for me, being in a model that kind of looks like that and that is productivity based, for me, I'm just like, that model doesn't do much for me because I don't want to work like that. And I'm not going to I wasn't even really enticed to, right? And so I think I just knew from the get-go. And honestly, my partners kind of knew that about me. And I kind of told them I need 20 minutes for a new patient, with which now looking at, I mean, now I have an hour, right, for my initial patients. But I kind of just told them what I needed. And there would still be things that fall through. You're working for a bigger group, but honestly, I felt like my experience there was amazing, and I still get a lot of referrals from them, and I still have really good relationships with all the surgeons there. And I felt like it was a really good first step for me. And I probably would have stayed longer had another opportunity not come up, but I knew at some point it was probably not my long term.
Got it. And when you talk about that, even the 20 minutes was not ideal, I'm wondering, because we definitely are familiar with that. All of us who've been in fee-for-service through residency, even medical school, and then as attendings, most of us have been through that as well. What was it that you wanted to deliver to your patients that you were struggling to do within those 20 minutes? Because I think that would be helpful for the audience to hear, because these are the things where, because I think about when you have the 20 minutes or 15 or 8 minutes, whatever it is, and you are so going through the motions of, okay, I got to ask these questions. I got to at least ask these questions. And then if I get to anything else, it's a great day. But for you, what were you longing to deliver that wasn't being allotted for in those short patient visits?
Yeah, I think it's the lifestyle medicine care, right? And I think it's getting to know your patient and getting to know them, who they are, what's going on in their life, what else is affecting their story, right? What can't they do because they have pain? What are their goals? What do they want to be doing? And everything else that goes into it. And even with the ultrasound, right? Like ideally, if somebody comes with knee pain, shoulder pain, I want to put the ultrasound on every person that comes in just so I can take a quick look and have a diagnostic baseline. But when you're working in this quick pace, you're almost like, I don't have the time to do it. And you're like, if you want to come in for an injection, we'll make sure it's ultrasound guided, but you don't have the time to do that. So you don't, like, just listening to them, right? And I feel like in my practice now, the feedback that I get and what I really feel like I can do is listen to patients and listen to their story. And I feel like that is half the battle of patients. And when they find a provider that is listening to them and they feel supported and they feel like someone's on their side and actually getting to know them and actually cares, they already feel so much better, right? You're not just coming in for a quick cortisone shot, you're on your way, see you back in 3 months, right? I want to have the conversation. Why is this really not the best thing to be doing consistently? Let's talk about what else we can do to target this instead of just these quick fixes. There's just so much else to it that I want to talk to them about.
And tell us about your next career pivot, because you went on to be part of a different type of group where you were the medical director. And I would love to hear, not only if you can tell the audience what was that group like, but also what was it that was just not vibing with your life that did not encourage you to stay?
Stay with us. We'll be right back.
If you're looking for tools and guidance for your DPC journey, check out the resources page at mydpcstory.com. You'll find our Start Here guide, links to upcoming conferences, our Substack newsletter, and so much more, all curated to help you succeed in direct primary care.
Yeah, so my pivot was an opportunity came up where I could start as you said, the medical side of a multidisciplinary group, which is predominantly PT, but also OT, chiropractic, acupuncture, which to me, I was like, wow, what better way than to have this one-stop shop where everything is just connected. You have this direct discussion and conversation with all the other providers. Everyone's on the same page treating the patient, which I still think is obviously the best way to do it, right? Because everyone's just on board and you can talk to each other. And I think that gives the patient the best outcomes. So yeah, and it taught me a lot because it was starting a medical practice from the ground up. And the guy who started, there was no other physicians there. And so I had to bring my knowledge of what do we need from a medical standpoint down to what supplies do I need, right? And what does the office need to look like? What other equipment do I need? Which is stuff that I never had to think about, because when you work in a big group and you just walk into these amazing resources like an ultrasound already being there, and your supplies are ordered for you, you just tell someone, oh, I think we need more 18 gauge needles, and you snap your fingers and they're there in 20 seconds. Now it's, oh my gosh, where do I start with this? Very clearly remember my first patient that I gave an injection to, and I had everything. And then I got to the end, I was like, do we have Band-Aids? And luckily somebody at the front had a Band-Aid, but I was like, all right, so add this to this, right? And it's just like, you figure it out. And so that part was really good. I learned marketing, right? I never had to market before. When you're in a big group, you go out, you meet people, but the patients come to you. They come to you because this group is really well known, and they're going to see you anyway, if not referred from somebody else within the system. But this is now a whole new thing where you have to go out into the community and tell people who you are, what you're doing, what you're a part of, what your goals are. And so that was really new to me too, which obviously was an invaluable experience for what I'm doing now. And it just turned out that kind of the vibe there was not for me. And I didn't end up having the autonomy that I was promised, whether that was with patients, whether that was just with my personal life. And I got to a point where, and I also just didn't feel super well respected. And I got to a point where I was like, I don't need to do this anymore, right? Like I know that I'm better than this, and I value myself so much more than this. And I just have to figure out a next step. And I had no idea what that next step was going to be. I was like, I can go back to the group that I came from, because I know that they haven't hired another non-operative doc yet, and they'd be happy to have me back. I know exactly what it would entail. Or I can take a lot of what I learned and go out on my own and actually do what I really want to do and practice the way I want to, the way that I feel like patients deserve, to have a schedule that I need. I have 2 really young kids, and I'm just kind of figuring out what worked for me. And obviously I chose the latter, and which is how I got to where I am now.
I think about different people have shared what was their breaking point and how did they find out about DPC, direct specialty care in your case. And I just think about that there's listeners out there that are thinking thoughts like you are, who have stumbled across your story. And this is real. Like, this voice of I want to practice differently is a thing. And so I love that you paid attention to what, was inside. I mean, that is something you said you valued yourself, which I absolutely love. And that's something that is really hard sometimes for us in the patriarchal system of residency and training. And you're a first year, you're a second year, you're a third year, you're an attending, like you have a pecking order. But to recognize that, one, you're doing this for the longevity of your career, but 2, you, like you just said, you have 2 little kids that you're like, man, I got to do what I have to do in order to also be a role model, whether it be something that they recognize now or later on, because you're showing them how life can be. And entrepreneurship is sure as heck not easy. But I want to ask here, when you opened, what was the timeline that you opened under, from saying, I definitely have to leave the role that you were in, to opening your own business?
Yeah, so I think I gave notice. I had to give 3 months notice. I think I gave notice in, let's see, July probably. June or July. And I opened in November. So I stopped at my last job in September, and then I officially opened doors in November.
And then I'm cheating a little bit because I heard this from your other podcast interview, but I would love to talk, because it's been a while since someone talked about a virtual address. So can you tell us about opening a practice, but not yet necessarily having a physical space? How did the magic happen?
Yeah, I mean, and those are the things that you just have no idea where to start, right? And so as I was kind of thinking about it, I was like, I don't have an address, but I need to apply for an LLC, and I need to apply for my employee identification number, and So I was just looking at the different options, and I think New Jersey is probably similar to some other states. You can't use a PO box as an actual address. So I learned about, I think probably one of my other colleagues was like, there are these virtual addresses. They're actually physical locations that you can go to where you have a tiny little mailbox there, but you can use that as your mailing address. And I was like, all right, well, I think that's my only option because I have no idea where I'm going to end up. I didn't want to use my home address. And so I just started searching. I went on the website of wherever I needed to go and started searching of places close to me that had these virtual mailbox options and just set that up so I could use it as my address for the LLC and for the IRS and everything else. And I am still working on trying to figure out how to switch all that stuff with the government to make sure everything is good. But I used it actually for the first, until where I'm at now, because I was like, it'll just be easier just to have that. And nobody really sends me things in the mail anyway. So I needed a mailbox for documentation, but nobody's sending me anything. If anybody's like sending me something in the mail, they're going to either call me or email me also.
When it comes to New Jersey in particular, you are only the third. So we need more New Jersey doctors on the podcast for sure. Do you have any tips for listeners who are wanting to practice in New Jersey, whether that be physically or remotely, that when it comes to things that are unique to opening a clinic in New Jersey in particular?
Yeah, I think the virtual address thing was the only thing I really had to learn, but really just knowing that that's an option is important. I mean, I think in terms of everything else, and I talked to my lawyer, I talked to my accountant, and I was like, what else do I need to do to make sure I'm legit? Because I think that's still a thought that goes through my head once a month is someone's going to be like, is this practice really legit? And so the lawyer just helped me get everything situated for the LLC. And then I had to get the employee identification number and made sure that I had all of that stuff in order. I don't know if there's anything else really specific to New Jersey aside from normal business stuff that you would need anywhere, the malpractice and the general liability insurance and other things that you'll need coverage for. But I don't think, unless, again, you don't know what you don't know, right? So maybe one of your other people will know something, but nothing that I have come across that's super specific to New Jersey.
Awesome. Love it. And super helpful. I've shared in my journey that we legit needed to publish a newspaper ad for 4 weeks before we could get our county business license. And we're talking, I did not open up in 1821. I opened up in 2021, and yet we still needed a newspaper article.
Really?
Yeah. So that is something that I love to ask specifically for people looking to practice in particular states. And I will say also that it is important to note that Dr. Weinstein saying that she's an LLC. In places like California, you cannot open a medical practice as an LLC. So definitely talk to the other direct specialty care, direct primary care doctors around you to see what are the restrictions within your locale where you're looking to practice. When it comes to you having experience in so many different clinics, in different specialty type of clinics, when you then thought about opening core sports medicine and you thought about, okay, now I'm going to get to do this my way, have the autonomy that I want, what were some of the things that you were like, these are total deal breakers that I must have or else I will not be able to progress in my own clinic?
Yeah. I think thinking about what you want, and I think some of the biggest questions, I did a lecture for actually my fellowship about starting your own clinic and some of the things that you have to think about. And I think one of the big questions is to accept insurance or to not accept insurance, right? That's one of the biggest things you have to think about with your practice and how it's going to run, how much staff you're going to need, what else is going to have to be part of that. And so I really went back and forth a lot, and I talked to a lot of people, pretty much everyone that I could find that was doing something similar, someone who was doing more of an out-of-network, cash pay, direct care versus other models. And I just decided, and I knew in my gut that I would not be happy in an insurance model. And I also didn't want to have to hire a staff right away. And I didn't want to have to fight with insurance for reimbursement for every last claim. I knew that was just going to affect the way that I practiced. And I know that that's a barrier for some people. And that's why I still like to volunteer at a clinic and provide care and do other things for the community. But I knew that in terms of my practice, I couldn't provide the value that I wanted to and really practice the way that I wanted to while under insurance model. So I think that was really one of the biggest things that I thought about.
And when it comes to the patient experience, how did you open your clinic in terms of, did you think about, okay, if I'm going to see a particular patient for any new patient visit, I want this amount of time. How did you design your workflow as you started, and has that changed over time?
Yeah, so pretty much all initial patients I have an hour-long consult with, or at least I save an hour of my time set aside for them, whether it's sports, whether it's lifestyle. I will tell you that when I first started, I separated the two and the sports versus the lifestyle, because I was used to a model where sports medicine, great, I can see somebody in a quicker amount of time. And whereas lifestyle medicine, like I'm really trying to learn more about the 6 pillars, really ask them a lot about themselves. And I got to a point, probably maybe 2 months in, and I was like, why am I separating these two? My care doesn't change, right? And it shouldn't change. And that's the whole thing that I want to be doing here, is incorporating the lifestyle into the sports and talking about stress and how that is affecting everything else in your life right now. Because when somebody comes in, they often don't want to just talk about one thing, and other things are going to come up. And I noted the first place I worked at, you couldn't even talk about 2 different joints on the same day. So you couldn't have shoulder pain and knee pain, right? You had to pick one. And so I even recently had a patient call who was like, do you see more than one joint in one visit? And I was like, of course, we have an hour. She's like, because I did have an appointment with another place that accepted my insurance, but they told me I can only choose one. And so I'd have to make another visit. And so I'm like, talk about convenience. And so, yeah, so I got to the point where I was like, I'm not changing the way that I care for these patients, and I want it to all be the same. And so that definitely changed in terms of my model and kind of how I thought about it, because I didn't like having the two separate in my head. They're not separate, and I wanted to make sure they were the same. So that definitely changed in terms of my mindset. Timing wise, I mean, it's still been pretty much the same. I just try to give patients time. If someone runs a little bit over, I'm also at a point where I'm not slammed, and I don't ever want to be totally slammed, but if somebody's there for an extra 5 minutes, that's fine, right? And so I just to figure it out, and it's worth it.
Yeah, I definitely will say it is lovely when the times when you do run over and you do have a patient who's actually using your waiting room for waiting, which I'm laughing at that because in direct primary care in our world, we laugh that the waiting room is not supposed to be used for waiting. It's to play and to have kids color and whatnot. But yes, when you do go over, your patients, just like you're describing, your patients are like, sometimes it's hard for us to remember that our patients are just like the one you mentioned. They were like, oh, I know that I get to see Dr. Weinstein for the things I need to see Dr. Weinstein for, not the one joint that's bothering me the most today. And they don't get as pissed off or stressed out as they did in fee-for-service. And I know that there's people shaking their heads like we are on the call here. When it comes to flow, I'm wondering about if you can tell us what are your office hours and how do you run your flow in terms of if there's someone with an acute issue versus someone who's a new patient versus someone who's coming in for a follow-up. How do you run your practice?
Yeah, so I just try to kind of stack them appropriately. I try to get people in as soon as possible. So, and I think patients are still shocked by that because especially somebody coming in for a sports issue, they're used to not being able to get in for a month or 6 weeks, right? When at that point, something's usually feeling better. So if somebody especially is calling for something acute, I try to get them, especially if I'm still at the office that day, I try to either get them in same day or next day. Like I had a patient yesterday text me or call me and wanted to get her son in because their knees have been bothering them. And I'm like, okay, well, what about tomorrow afternoon? And so I think that goes really far, but I try to be really accessible to patients, but also have my boundaries, right? And so I take my kids to school every morning, and with my new office now, it's so much closer. And so the commute is so much better. So I come straight after that. So I'm usually here by, 8:45 or so. And I start seeing patients then or whenever available. And I usually cut off around 4. But that being said, if somebody needs to come in later, then I figure that out with them. And so I have hours, I would say, but I'm also, if I can be flexible to help the patient out and see them when it's more convenient for them, then I do that. But otherwise, I try to stick to my schedule and get everybody in a timely manner. I wouldn't say I have, at my first practice, it's like you have a block for a new patient, a block for a follow-up. I just schedule people as they come. And just whenever the time is available, and I just try to kind of stack them close together so the flow is a little bit better for me, but then always leaving a little time here and there for me to catch up on things.
Awesome. And when it comes to the onboarding for a new patient in particular, what are some things that you include in your onboarding, whether it be through a pre-filled questionnaire before they get there or when you're talking with them, because you're coming at them from family medicine, sports medicine, and lifestyle medicine perspectives all in one doctor?
Yeah, so the onboarding process, I would say, has changed a little bit. The forms that they fill out have not changed, but I hired my first virtual assistant probably back in, I guess, end of August or so, which has been a total game changer. So instead of it just being me on the phone with every patient, I actually have my virtual assistant call them. She kind of knows exactly what I say to them, talks about how long the visit's going to be. And then obviously the question always comes up, do you accept my insurance? If somebody's getting referred to me, they know kind of how I operate. But if it's just a new patient who's questioning and just saw my website, she kind of goes through that whole spiel about how we want to provide the value for them and make sure they're getting everything answered that they want to and making sure that they have a game plan in place. And some patients are like, great. Others are like, I'm going to go with my insurance. And that's fine, right? And going into this, I think every DPC, DSC doc knows that this model is not for everyone, right? But it's the patients that do come, they're incredible. So they kind of get that whole spiel, and then essentially we send out an email that tells them what time their appointment is, gives them the link to the forms to fill out, which is through my EMR. And that all then just gets uploaded directly into my EMR. So it establishes them as a patient and then just gives them directions on how to get to the office. And that's it.
Love it. And even on your website, something that I was like, oh, I got to add this to my website it was like find directions, and it led the person to a Google link so they could look up your directions. I was like, that's awesome. See, I mean, this is like literally, it doesn't matter how long you've been open. You learn new things every day from our fellow physician entrepreneurs. I wanted to ask you here, because this actually happened to me yesterday, and I was like, oh my gosh, I'm so excited to talk to Dr. Weinstein today. I'm going to ask her. I have been taking care of a patient for probably close to 10 years now. And I'm like, how have we never talked about trochanteric bursitis? Like I watch my patients when they get out of their cars, when they're walking down the hallway. I know my patients well enough that I'm like, you're walking a little different today or whatnot. But I was like, have I noticed any? And I probably see this patient every maybe 3 or 4 months. And I'm like, I have not noticed any difficulties getting in and out of chairs, needing to use the handrails on the chair. But I'm just, I think about when we've talked about you don't know what you don't know. How do you evaluate your patients in terms of not necessarily like wanting to find procedures to do, but like I did 2 trochanteric bursitis injections yesterday, but I'm like, the whole time I'm doing it, I'm like, how did you not see this? And so I'm just wondering, in terms of your patients, do you have certain questions that you will prompt a person with, again, not to get a procedure out of it, but just to be holistic about their care? Because if they're a certain age, if they have a diagnosis of osteoporosis, if they have a previous knee injury, I just wonder like how you, with the time that you have in your practice now, how do you go about finding out as much as you can about the patient, even when they're not necessarily forthcoming with, oh, by the way, I'm having issues?
Right. Yeah. So I think having the time to talk to them really helps. And it depends if they're coming in with an acute issue. Like if somebody's coming in specifically for the hip, then obviously we're going to talk about that and ask all the standard questions. But I also really want to always make sure that I know is there something that they're being limited by that they can't necessarily do, right? And that might be something in their day-to-day life. That might be something workout related, right? They might say, my shoulders actually always bother me. And I feel like I actually can't do a push-up, or I can't do a plank, or I can't do an overhead press because it just has always bothered me. But I just chalked it up to getting older. But it's something that clearly has limited them, or they if their shoulders hurt or something like that, and they say, it's hard for me to walk up and down the stairs with my baby, or it's like a grandparent, right? And they say, I want to be able to sit down on the floor and play with my grandkids, right? You always have to ask people what it is that they want to be doing. What is their ideal life look like, and what is stopping them? And because sometimes people who have been in pain for a really long time, they just live with it and they don't realize that they don't have to be in pain and that they can live differently. And I see that so much now with my practice, because it's these people who haven't necessarily gotten answers from the traditional system or from other providers, and they just learn to live with it. And when you actually start to figure things out and talk to a physician or a provider who asks the right questions, who does the right things, you're like, oh my gosh, there's hope, right? And that to me is bringing that hope back to people's lives and being like, I don't have to live like this, or I can get out of this pain, I think is one of the most rewarding things. And I have a patient that comes to top of mind, and she's really active, like an avid runner, works out all the time. She's young, she's super fit, but she had pain in her whole body for so long that we just started targeting little by little, just talking about everything else going on. And she left me a voicemail the other day, just almost in tears, just saying, I can't even begin where to start. Like, I don't even know where to start, because I can't remember ever feeling like this in such a long time. And so I think just listening and also just seeing what's missing out of people's lives, right? What do they want to be doing? What are their goals? What do they love doing for fun? And asking these things so you can see what are the limitations and what might you be missing.
Love that. And very different than, I got to ask you if you wear your seatbelt today. I can't listen, can't touch you, but I got to ask you if you wear your seatbelt today, because that's covered. Yeah, done. So thank you. That is an amazing answer. And I'm totally going to listen to your interview and incorporate what you said also. And just the way, like, we're 4+ years into our practice, I kept thinking about, like, how did I miss this with a patient? And we all miss stuff, but I love what you said. And I'm going to incorporate what the questioning that you just mentioned into our practice. I love it. So thank you for that. When it comes to people opening who want to do POPAs, who want to do sports medicine related procedures, and even lifestyle medicine, what are your tips for opening a clinic with? Because, like, you have your ultrasound, but I don't know, like, how did you come to get your ultrasound if you had connections? But I was talking with somebody yesterday there is this doctor wanting to sell an ophthalmology machine, and it's $28,000. And I'm like, dude, a person opens a practice with less than $28,000. So how is someone going to afford a machine like that? So what are your tips on things to have when you're opening a clinic like yours?
Yeah. And I think I learned from a lot of the lectures, the podcasts, the people that I talked to, I was trying to keep it as slim as possible. And there's so many people that will say, don't overbuy in the beginning, right? Just get what you definitely need and work with that. And then you'll see kind of what else comes along. And so for me, ultrasound's a big part of my practice. Obviously, I do every single injection under ultrasound. I do a lot of looking diagnostically to see what's going on. And so I knew I needed an ultrasound. And equipment-wise, there's other things that I want for sure. And I've now gotten some of them, and I just purchased another. But I was trying to keep things as streamlined and slim. I didn't have any other staff for 9 months. And so I think that piece of advice was really important, is just think about what you absolutely need. And for me, it was an ultrasound. And so then I started looking into different ultrasound machines, right? There were the ones that I had worked on at the past 2 places. And I had gotten used to talking to reps and things like that when I was at my second job, because there was no one else that was going to do that. And I knew the questions to ask, and I had to be the one to demo all of these things out. And so I was just looking at a lot of different products, talked to a lot of different reps, talked to a lot of different people, posted in different groups. And ultimately I ended up going with an ultrasound, a portable, like wireless ultrasound that I absolutely love. Is it going to be the last ultrasound I have? Probably not. But for me, at the price point that it was at, and actually at the resolution that I get on it, it's probably better than what I was working with at my past two jobs, which were using 12, 15-old machines. And even though it was like probably better quality back then, now what I'm using is so much better, and I can accomplish really everything that I'm doing. Is it the most high definition, amazing ultrasound? No, but I knew that I could get by with this. And for the price point, I was like, I'm doing this. I'm going to try it out. And it's been great. And so I kind of went into it like that. I've now since purchased a Shockwave unit, which has also been amazing, much more expensive. But again, you just have to kind of think about how you're going to use it. Is it going to be worth it in the beginning, or is it just going to look pretty while it's sitting there? And so I think you just have to think about what you really want, what you really need to operate, and try to keep it as little as possible. Try to keep the overhead as low as possible. And I think that's really how I started. And I felt like that was helpful because I wasn't stressing myself out trying to do and buy all this fancy stuff. And I was just like, let's just start. Right? You have to start somewhere, and you'll grow and you'll learn different things and you'll see different stuff comes out and you'll develop different programs, but you just take it day by day. And so that's kind of how I started.
I love it. And I just think about, as you're speaking there, that you had the autonomy to make these decisions and figure out what was going to work for you to reach that goal of keeping your overhead low and then adding staff on as you went forward. So here I think about, when you talk to people about lifestyle medicine, telling a person all of the things is really intimidating. And so helping people just do one thing to start. You can't eat an elephant all in one bite. You got to eat them. Yeah. Hopefully you're not actually eating elephants, but you know, the metaphor, one bite at a time. For the listeners out there who are especially wanting to open up their own direct primary care or direct specialty care practice, what are some small bites of information that you would leave them with in terms of, if you're thinking about opening your own practice, these are the things to definitely think about or do when you're starting out?
Yeah. So, I think some of the biggest things are talk to as many people as possible, listen to podcasts, read books, just really reach out to your community, to people who are doing the same thing. There were some really great resources I know through like the Private Practice Playbook by SoMeDocs. That to me was so helpful in starting my practice, because when they brought on all these like different speakers, it was physicians, it was accountant, it was lawyers, and it was all of these things that you have to think about it. And it almost gave me a to-do list of what I needed to do and brought to my attention all of these things that I would have otherwise not thought about. So I think that was really important. And I think just even picking one or two of these resources gives you a place to start, but not getting so overwhelmed, right? Like, don't listen to every single podcast that's out there. But while you're still in the thought of opening, do try to get as much information as you can to think about what you might need, right? Like, I reached out to other sports docs who started their own practice, and I'm like, what supplies do I need? And it's such an amazing community of people wanting to help each other who are going out on their own. And she was like, I'll just send you our supplies list. And I was like, you don't even know how helpful these little things are. And so I feel like when other docs who are thinking about doing the same thing reach out to me, I'm like, of course I want to help you, right? Because I was in your shoes. And if there's anything I can do to make it more helpful for you, I just had another doc reach out last week who was like, I'm thinking about opening my own practice. I'm PM&R. Would love to just chat with you. And I think just having that conversation with people is like, okay, I'm not alone. I can do this. And like kind of then establishing your network, you can always go back to those people, right? So I think really just reaching out to your community members and even joining some of these Facebook groups, although looking at every post, I think is really overwhelming. So I think even just like a few of these resources, like pick 1 to 3 of them and just kind of get after it, right? And then start establishing a network of people that you can reach out to for questions here and there. Because I certainly still lean on and reach out to all the people that helped me get here.
The last thing I wanted to ask is about your ability to be a doctor, be a mom, and also do fitness classes. So tell us about how that even started, because it is so, I've heard in other podcasts how that's really your core audience of who you want to, your core avatar of who you want to have join your practice as well. And it's so different and so awesome that people who know you as the person who's like helping them correct their form in class is also the person who can like inject their knee if they need it.
Yeah, it's awesome. It is so fun. It started because I was out marketing, and the people I want to be marketing to are the people who are kind of going to these local gyms who are invested in their health, but obviously might get injured, might have other stuff going on. So I was just going out marketing, and I would always offer to these places, can I do a talk? Can I do something like this? And this one owner of a gym in downtown Princeton, we started talking, and then I ended up moving offices, and I was like, do you have any like space that I could rent that I could work out of? And this place is literally an old garage. And he's like, literally, we don't have any space. He's like, but on the off chance, do you have an interest in teaching group classes? And I was like, I do. I was like, I don't really have any experience. I was like, that being said, it has always been a dream of mine to like teach a fitness class on the side of being a physician, because when I was in med school, I was living in Philly. The gym I went to, one of my favorite classes was a physician who worked at Penn. And I was like, how cool is this, right? You get to be in this atmosphere, like doing what you love and being also around all these other people. And I was like, all right, man, what do I need to do? He's like, just start. And he's like, most importantly, you just need to see if you fit in with the vibe. And that was really it. I mean, I just started since then. So once a week I teach a class. It's now on Friday morning. So it's right before this. And it is awesome. I mean, this community, I mean, some of them have become such good friends. A lot have become patients. But again, just being around them in this different setting is so much fun, where we're just like listening to music and working out and sweating, and it is so fun. It's so rewarding. It's like everything I love. I'm just so passionate about working out and talking about that. What better way than just to be out in the community doing it and meeting all these incredible people.
Amazing. Thank you so much, Dr. Weinstein, for joining us today.
Yeah, thank you so much for having me on.
Thank you for listening to another episode of My DPC Story. If you enjoyed it, please leave a 5-star review on your favorite podcast platform. It helps others find the show. Have a question about direct primary care? Leave me a voicemail. You might hear it answered in a future episode. Follow us on socials at the handle @MyDPCStory and join DPC Didactics, our monthly deep dive into your questions and challenges. Links are at mydpcstory.com. For exclusive content you won't hear anywhere else, join our Patreon. Find the link in the show notes or search for My DPC Story on patreon.com. For DPC News on the Daily, check out dpcnews.com. Until next week, this is Maryal Concepcion.